Um, Welcome to our September Southside Wellness Coalition membership meeting. We're really excited to have you here today. We have a wonderful list of agenda items for you to get through. But before we hop into any of that, I'd like for everybody to please quickly introduce themselves. I'll start and then I'll pass it to the folks in the room. And then if you could just popcorn it to the next person when you're done, that'd be greatly appreciated. Kenan, I'm going to kind of rely on you to let me know when the folks in the room are through. I think I can see everybody, but just in case I miss somebody, please help be my eyes in the room. But good morning again, everybody. My name is Liam Hudson. My pronouns are he, him. I am the founder and CEO of the Lean In Project, and I currently have the honor of serving as the chair of the Southside Wellness Coalition. I'm so excited to be with you all this morning, and I will popcorn it to Catherine Maloney.
Oh, hey, everybody. This is Catherine Maloney. Thanks, Liam. I'm with Tri-County Community Action Agency. I'm the Chief Financial Officer and Development Officer there. I've served on the leadership team a couple times, and I'm happy to be here. I will go to Kimberly Gordon. Kimberly, you're on mute.
Nope.
I can pick somebody else.
Well, I thought she came off mute.
I thought so too for a second there.
1001. No.
Oh,
there she is. Yeah. Oh,
no.
okay, seeing Shelly Clary just popped up. Go for it, Shelly.
Good morning. My name is Shelly Clary, and I am the education specialist for the Virginia Poison Center at VCU Health. And I will send it to Elena.
Good morning. I'm Sherry Elena Martin. I am the housing case manager at Tri-County. I am also on the leadership for the Southside Wellness Coalition, and I am enjoying the lovely fall weather we're having. It's rainy, but still fall. And I will send it to Dennis.
Dennis Damians, mainly working with disabled veterans, but also had the opportunity to work with families with disabilities. Real quick, please write it on your calendars. I will remind y'all when it comes around to open times. October 13th, which is a Sunday, we have families with special needs. We'll be at Palmer Point, which is on Route 4, just across the dam. If you're coming from our side, you go south across the dam and it'll be the first park on your right. And it'll be from 2 till 4. And it is for any family that has any type of disability. There will be free ice cream, free games. There will be canoes and kayaks that have outriggers, some without. But what we're trying to do is, again, let these families network. We go with those that have disabilities from literally toddlers all the way up through those into their 30s. We want those families to be able to coalesce, to work together, and then to be able to network together. So again, October 13th, if you have any of those, the only request I make is just let me know so I can make sure we have enough support for them. But for details, have you talk to me, because there's a lot of things for safety and all that we make sure that these families understand. So I'll talk to you about that later. Thank you.
Awesome. And if you have a flyer, you can send it to me. I can put it on social media.
The originators are families embracing autism together. As soon as I get a flyer from them, I will send it to you.
Great. Okay.
But that way, this is just kind of but we have families with MD, CP, numbers of wheelchairs and other stuff. So we want just, all you have to do is be a family with a disability.
Okay.
I'll pass it on to Kimberly.
Okay. All right, Kimberly.
Give her another try.
Hey guys, me Kimberly or other Kimberly?
You're good. Yeah,
I'm
you.
sorry. Hi, Kenan, by the way. Kimberly Gordon. I'm a teacher at Halifax County High School. I sponsor 2 clubs, Peer Mediation and Yovaso. Peer Mediation is a conflict resolution group where students come together to help their peers resolve conflicts. We talk about mental health and things like of that nature. Yovaso is about traffic safety and passenger safety, all things dealing with just being safe on the road. So that's it. Am I supposed to do anything else? I'm sorry. A teacher walked in my room right when you guys started the meeting.
That's great. And Kimberly was on the coalition back when we first started and been on the leadership team. So she's been great to see you come back and join us.
It's good to be here.
All right, we'll popcorn it to Stephen.
Stephen Wilson, member of the recovery community, citizen of Mecklenburg County, and prior leadership team member. And I'll send it to Allison.
Allison.
Hi, everybody. I'm Allison Byrne. I am the Community Engagement and Partnerships Coordinator at the Central Virginia VA Medical Center, and I am part of the suicide prevention team there. Oh, I always forget to popcorn. I'll popcorn it to Hannah.
Hi, everyone. I'm Hanna Schweitzer. I am the Virginia Mental Health Access Program Administrator at DBHDS, and you'll be hearing more about that shortly. So thank you all for having me.
Who do you
I
popcorn?
also forget to popcorn.
Oh, yeah.
Let's see. I don't know who's in the room there. Barbara Johnson, have you gone?
Good morning. My name is Barbara Johnson. I'm a community health worker with the Virginia Department of Health, the Southside Health District, serving Halifax, Mecklenburg, and Brunswick County. And I'm going to popcorn it to Bruna Link.
Good morning, Brenna Link, Population Health Manager for Pennsylvania, Danville, and Southside Health Districts with the lovely Barbara. I'll popcorn it to Veronica.
Hello, everybody. I'm Veronica Turner. I'm the partner here that works with Kenan at Southside Behavioral Health, and I'm happy to be here. And I will popcorn it to Shelley now.
Shelley went. Let's see. I think we.
Elena.
No, Elena went.
Elena went already?
I think everybody. Yeah, everybody. All right. And then finally, I'm Kenan Tyner-Smith. I'm the fiscal agent for everybody on the Zoom and here in the room.
You're welcome.
Welcome, welcome. All right, so back to you, Liam.
Thank you, Kenan. I kind of wish you were my personal fiscal agent sometimes. All right. Thank you all so much, everybody, for introducing yourselves. Just in case you didn't see, for those of you on Zoom, please put your name and org in the chat. It just helps us with note keeping and, make sure we're accurate. Speaking of note keeping, Kenan, can you go ahead and pull up the 8:15 notes, please, and we can review those really quickly?
Absolutely. Those of you in the room, you also have a copy of last month's minutes as well as today's agenda. All right, those of you on the Zoom, you should now be able to see, I've shared screen, the minutes from last month. Why is I can't pull them down?
We can see it.
Oh, there we go. Hang on. There we go. There we go. There we go. All right, and those minutes are posted on, the minutes came out in the newsletter this week. Newsletter always comes out Monday before the meeting of each month. The recorded version is also on our blog connected to the minutes. Guest speaker was Mr. Sean Barksdale. Okay. Questions, concerns?
No.
Hearing no questions or concerns, can I call for a motion to approve?
I move to approve. Then I'll second.
All right, Kathy
Catherine and Elena, you guys are always my power duo on that. That's nice because every month I do the minutes, I get to that section. I'm like, oh, okay, well.
Kenan, your audio is cutting out a little bit.
Oh, is it? Okay. Maybe
That's better.
I thought I started leaning in. All right, I'll be shouting. Sorry about y'all in the room. I'll shout.
But we're okay with leaning in.
Need a new laptop. I got a new camera. I haven't got a new laptop. It's probably what it is.
Okay. So you cut out on me anyway, a little bit, Kenan. Everything approved. I heard Elena and Catherine. I'm gonna get them some buzzers.
Yes, Elena and Catherine are in the minutes.
Okay. Thank you.
I need the agenda.
Anna.
All right. We're moving right along. Thank y'all for approving the August 15th minutes. Next up for you all this week, we have Hanna Schweitzer with the Virginia Department of Behavioral Health to talk about the Virginia Mental Health Access Program. And so I will send it over to you, Han, to take it away.
Okay, can everyone hear me okay? Yep, okay. And you can see my slides. Let's see. Okay, all good. Great. So like I said, I'm Hanna Schweitzer. I come to you today from the Department of Behavioral Health and Developmental Services, and I am here to talk to you all about the Virginia Mental Health Access Program. And so feel free to put questions in the chat, or I left some time at the end for questions as well, but I'm pretty easygoing. If you want to interrupt me, no problem. So with that, let's get started. So I'm just going to frame the beginning of the presentation with a little bit of how we got to the Virginia Mental Health Access Program, and then a little bit about the program, and then some data and outcomes. So what we know right now is, the climate of mental health for kids is not great. You can see from the statistics that 56% of kids surveyed in 2022 said that they made a plan for how they would attempt suicide. And so we are seeing a lot from the data, just the scope of the problem in Virginia. And then coupled with the scope of the problem, we're also seeing a workforce shortage. And I'm going to go really quickly through these statistics and slides because I know that you're all very familiar with what's going on. But I think I want to point to the last bullet here, which is only 4 counties in Virginia have sufficient child and adolescent psychiatrists. And so we're really seeing a gap in mental health care for specialty care around child and adolescent psychiatry. And this is a map, really just visualizing what that statistic is showing. CAP stands for Child and Adolescent Psychiatrists, and you'll hear that acronym repeated a lot throughout the presentation. So you can see just the shortage and severe shortages in the counties of Halifax and Mecklenburg and Brunswick as well. And so a little bit more statistics, but 100% of Virginia localities are mental health professional shortage areas. There are only 14 child and adolescent psychiatrists for every 100,000 children in Virginia. And over 65% of pediatricians say that they lack the training and knowledge to be able to help their patients in pediatric mental and behavioral health. So therefore, enter the Virginia Mental Health Access Program. And so VMAP is really hoping to bridge the gap between child and adolescent psychiatry care and that education piece around behavioral health care for kids and adolescents. And so I just want to preface this with VMAP is a unique program in Virginia. It's not a unique model to behavioral health care now throughout the US and outlying territories. There's actually programs like this throughout the country, and we work with each other to learn more about, you know, what we're doing. And they're all funded a little bit differently, but it's part of a larger network of mental health access programs that's addressing behavioral health care shortages in all of the states. So the Virginia Mental Health Access Program, we like to divide it into two arms. And so I'll start with the provider education arm, which is for prescribing providers, pediatricians who treat and see youth under the age of 21. And so any prescribing provider can attend our education sessions for free. And they cover a wide range of topics, you know, from, you know, specialty 0 to 5 education, LGBTQ, social determinants of health, and then they learn like screening and diagnoses and how to manage and treat pretty, you know, like anxiety, depression, you know, common behavioral health and mental health cases in their pediatric offices themselves. And then we also have a guidebook, which I'll get to a little bit later. And then we also have what's called the VMAP line, and the other arm of VMAP is the consultation line. And so it really connects primary care providers to regional hubs that offer pediatric mental health consultation and care navigation to support their patients. And so if you're a pediatric provider and you call into the VMAP line, you'll be connected with a care navigator or a licensed mental health provider, so a social worker or a psychologist, and or a specialized physician like a CAP, a child and adolescent psychiatrist, developmental pediatricians, who can really provide that one-on-one peer-to-peer case consultation to help the primary care providers work out, you know, what they might need, the support that they might need for their patients who are experiencing a mental health challenge or problem that they're presenting in the office. So these are our hubs. So if you are in our central region, you'll be connected with a hub at VCU. VCU is our VMAP partner. They staff the VMAP line for us. And we really depend upon and rely upon and are very thankful for our partners throughout Virginia. And they you know, hone in on their region and know about the specific resources throughout their region, so that they can best help families and children and the pediatricians be connected to the services that they need to be connected to. We also have Mount Rogers, which is our only CSB hub, and that's in our southwest region. So we have a few expansion projects right now. We have our early childhood expansion, which was allowed VMAP to receive additional state fundings to expand into 0 to 5 early intervention. And a hub was created with Carilion in Roanoke to support the early childhood expansion. And really what it did is it adds another line. So if you call in to our VMAP line and you press 6 for under 6, you get connected with specialty early childhood specialists, sorry, for early childhood, so 0 to 5 population. We also expanded our training opportunities to really hone in on that 0 to 5 toddler, you know, connection and the importance of early childhood mental health. Our latest expansion has been the maternal mental health expansion. We're calling that VMAP for Moms Plus. And so it looks very, very similar to VMAP model, but really what it is bridging the gap between early intervention and child psychiatry and child mental health, and then maternal mental health, because we know mental health for moms and pregnant and postpartum individuals really has an impact on baby and kids as well. And so The VMAP model will be available to maternal health providers such as OBGYNs, doulas, and anyone who sees pregnant and postpartum persons at their practice. They'll be able to consult with our access line, be connected to a perinatal psychiatrist, licensed mental health providers, and care navigation for maternal mental health. So we're partnering with Postpartum Support Virginia. They're our maternal VMAP for Moms Plus hub, and they've been great getting the word out about maternal mental health and our Moms Plus program. Our last expansion right now is our emergency department education pilot. And so we've gotten requests from emergency departments who see a lot of kids and adolescents crowding in the ER. And I know we're not going to solve the bed crisis and the emergency department crisis and like the workforce shortage, but we were called in to provide trainings to emergency department physicians to at least try to be a first stop in managing, diagnosing kids and adolescents, to maybe reduce like the waits for kids who are in the ER, maybe like transfer them out of the ER if they don't need to be in the ER, and get them back into the community and really connect them to community care. And so that's where VMAP has come in to provide the training around VMAP, what our care navigation services are, and they've been pretty successful with 3 webinars in November and December of 2023, and I think we have 4 upcoming webinars for the fall around for our emergency department folks. So now a little bit of data, just so you can see, our program reach and what we're doing. We've had 1,640 registered providers. And so anybody who calls or utilizes VMAP's education services or the consultation line is considered a registered provider. In its lifetime, we've had 6,984 calls to the VMAP line, 7,353 unique patients served, and 1,335 providers have gone through our training. A little bit more specific on our education, just like the topics I was talking about, suicide prevention, collaboration, like systems of care. We are expanding our autism work and actually have added in a specialty autism specialist care navigation. And so that person is really responsible for all of our autism, like screening questions, diagnoses, and providing some brief intervention around autism management for kids and adolescents. And so this is our, another part of our education is our VMAP guidebook. This is available for free on our website. I know we're mainly a program for prescribing providers in pediatric offices, but really the guidebook is available to any provider or family. We have a lot of family resources in there, and we've also translated it into, I think, 4 or 5 languages as well, which is all available for free on our website. And so feel free to go ahead and take a look. It, goes through evidence-based practices, resources, and we're really excited to be able to share that with you all for free. A lot of screening tools, diagnoses tools in there as well. And so now I'm going to move into a little bit about our care navigation. So our care navigation is for our families. We connect directly with the families around what they may need, create personalized treatment plan for the families, and connect them to the care that they are seeking. So you'll see 71% of families are seeking counseling and therapists. 26% are seeking psychiatrists, and then, so on. But I also will say that 70% of the calls that we get to the VMAP line are also requesting care navigation services. So it's really showing that, you know, families are needed more than just, you know, therapists and counseling and that psychiatry, but they're also needing to connect to other community-based resources and services as well. So really our goal is to train pediatricians to be able to help and manage and support kids, but for that ongoing care and more consistent care, we're helping those families connect with a counselor or therapist. So some care navigation outcomes, you know, 61% of families were provided resources, 7% were no longer interested in services. You know, you can see a little bit about why or what the barriers to care are. Resource availability issues, definitely a thing. Insurance and financial issues are certainly come into play here as well. You know, if you're a primary care provider treating adolescents and children, we encourage you to, you know, register for VMAP, or, you know, please take this presentation back and share with your colleagues who may be helpful to know about VMAP. And, you know, we're happy to connect you with whomever you need to talk to, and provide support where we can. And so I think that's all. I'll leave, you know, my contact information up. You'll see our medical director and VMAP director as well. But happy to answer any questions or go back to anything if needed.
And that's Catherine. I do have a question. The information, the training and all of that, is that just for licensed like doctors, medical doctors? Or do you open that up to like licensed social workers, therapists and all of that?
Yeah, I think licensed social workers and therapists can also attend our trainings as well.
Great, thank you.
Yep.
Hannah, Dennis Damians, one question and then one comment. First question is, what do you believe from your organization is the cause for this increase in adolescent mental issues? In other words, from us on the veteran side, we believe a lot of it has to do with the social media and just spread of misinformation and, shall we say, bad things.
Yeah, I definitely can see, you know, social media has come up a lot within VMAP. Our medical director, Dr. Chung, who was the most recent past president of the American Academy of Pediatrics, they're working on a training for providers around like healthy social media use, social media for, you know, how can pediatricians be involved in like helping kids and families manage social media and model healthy social media usage. So I definitely think that you know, is something that we're addressing and, you know, working to address. You know, I think just like social drivers of behavioral health and mental health, you know, kids are seeing, you know, I think even before the pandemic, you know, kids were seeing a lot of, you know, I guess, like you said, bad stuff online and in the world. And, you know, the pandemic, I think, exacerbated that. And now we're kind of coming out of that and helping to, or seeing kids in pediatric offices who need more than just a flu shot. They need, you know, support around mental and behavioral health as well. And so we're definitely trying to address that.
Can I ask one question before you comment?
Yes, ma'am.
Because it piggybacks on this. Is the early intervention, I'm assuming this was very purposeful, that you went to where problems are rooted a lot of times?
Mm-hmm.
Is that the case, that was more along the lines of, or was it because there's so few people who specialize in that, or a combo?
Yeah, I think you hit it right nail on the head. Like definitely a combo, but we were seeing and getting a lot of requests for early childhood. We've actually just released we release yearly impact reports for VMAP as a whole. You can find them on our website, but we've just released an early childhood specialty impact report that goes through our now that we've had the program for a full year, all of the data that we're seeing from that line. And I think like 8 to 10% of our calls are for early childhood. And so we're seeing that need for sure for early intervention. And I think people are seeing, you know, are starting to catch on with like the earlier we catch it, hopefully the better, like more positive outcomes that we can have. And, you know, so I think, you know, a combination of both, but for sure we were hearing from our pediatricians that they needed more support. And so we were able to advocate. I think I didn't say that. So I sit within DBHDS, but we receive money from the General Assembly at our office, and then that money goes out to the Medical Society of Virginia. And so the Medical Society of Virginia actually, you know, hires and works with all of our state partners and our hubs to put on the program, so to speak. And so that's sort of how the money flows and the program operates, you know, generally.
Thank you.
And
Yes.
can you? Oh, I'm sorry, Dennis.
You first.
Thank you. Han, can you expand a little bit on the hub piece? I know that, you know, in the map that you displayed, you showed that Halifax in particular in this region had a deficit in providers.
Mm-hmm.
So would we, I guess, we also don't have a hub here. I'm assuming that's because we don't have providers, or is there a way to establish a hub so that we can get providers here? Does that make sense?
Yes. So your hub would be the central region. And I know that like it seems very far away, you know, having lived in Halifax, I definitely understand that like calling into a line that's staffed in Richmond may not always feel like the most comfortable, and that they know really what's going on in Halifax County, for example. We do work with, so if you're in Halifax County, your call will be directed to our central hub, and they will work with you to, you know, find as many resources as they can in that area. They will also work with our hub in the Southwest County. So they may work with Mount Rogers folks to assess like their resources. But the child and adult, like you'll still be connected to a child and adolescent psychiatrist, even if they're not located in Halifax County. They'll still have a familiarity with the region because they're staffed on the central hub. So hopefully that makes sense. So the people aren't actually, we're not maybe actually growing like the workforce in the county, but we're hopefully connecting people in the county to a workforce that's maybe a little bit outside of their county, but still getting that regional knowledge because they're on the central region hub.
Got it. Thank you.
The last comment I wanted to make is for a lot of us, when we work with the veterans, what we have is we have numbers of lay people trained by the National Alliance on Mental Illness for PTSD, because initially we had very few, just like you, of the psychiatrists and the professionals, the behaviorists. But NAMI developed numbers of courses for caregivers, for other local people, to then assist those professionals in doing some things so that we could get regional work done. And then for additional, it would go to the professionals. But this way there were places locally for those people to get to at least help in some of the casework, some of the other areas, and particularly for us, for the numbers of PTSD and traumatic brain injuries. It just kind of acted as a bridge until we could get more of the degree people. Have y'all looked at that, Hannah?
Yeah, so we work with, we have regional care navigation advisory boards. So each region has a board that's made up of, you know, I know that there's a representative from Southside Behavioral Health on our central region there. And then we also have partnered, so NAMI has come and they've joined all of our regional advisory boards. And so they're able to come in, talk to our VMAP folks and our other regional partners about their services. And that way our care navigators know, okay, if a family calls and they're in need of some support, oh, let's connect them to our NAMI colleagues. And so it's sort of like a way to network and understand what's going on in the field. And we've definitely connected with our family support partners of Virginia and, you know, other sort of peer specialists to help as well. And I will say that sort of related, but the next iteration, I guess, of VMAP is going to be the adult psychiatric access line. So we're working to expand the model and create like a separate but also together program that will serve individuals with substance use co-occurring with mental health. And down the line, the next step will be elderly and older adult mental health care. So stay tuned. I'll give you that little tidbit as well.
Thank you very much.
And Hannah, are they looking at anything where, like, I look at that map that's up there right now, and predominantly you're talking there are no caps in any rural area across Virginia. None. But I don't know how much of that population resides in that red area, but I mean, you look, Danville seems to have a severe shortage, but they at least have some. But this whole catchment area, all the way north up to Richmond, appear to not have anything.
Mm-hmm.
None of those counties.
Yeah, so yeah, I know that, like,
I know that's a different issue, but you know.
Yeah, I know, you know, VMAP, you know, we can't say that we're solving like the workforce shortage. We're definitely trying to equip. That's why it's a program for existing providers in the field of pediatrics and family medicine to hopefully like ease some of the burden of child and adolescent psychiatry and equip existing providers with the knowledge to you know, help the behavioral health crisis. I do know that VMAP is working with medical schools to train and kind of encourage, you know, psychiatry and child and adolescent psychiatry, and to train the workforce even before they're out of med school. And so, you know, hopefully that we can see make an impact, but we're not going to know, you know, right now what that is exactly.
Thanks.
Alrighty, any other questions? Floor is open.
And I was wondering if you had any, I guess, information, opinions, whatever, about non-psychiatric medical care. So, you know, pediatricians prescribing psychiatric medication or psychiatric nurse practitioners. I'm assuming that a lot of the overflow is going there, and I'm not sure if we're seeing it.
Yeah, that's a really great question. Actually, a large part of our VMAP line are nurse practitioners calling in and learning how to prescribe psychiatric medications. So I know we've gotten a lot of feedback from PCPs and NPs about their comfortability with prescribing psychiatric medications, especially because they only see their patients maybe once a year for their school physical. So they don't necessarily know, you know, what to prescribe, and they're getting a kid straight from the hospital who's now put on medication. And so that's really why VMAP is there. So their pediatrician can call in and feel more comfortable with prescribing and have a psychiatrist walk them through and talk them through that process how much, what's good, what's not good, you know, what it looks like. And so that's a large part of our consultation line, is that medication consultation, and the training and education is getting providers more comfortable with what that looks like. So did that answer your question a little bit?
Thank you.
Okay. Yeah. Well, thank you all so much. If you have any other questions or want any follow-up data, or you know, something pops into your head, please feel free to reach out. You can reach out to Kenan or Liam and they can get it to me, or you can reach out to me directly. But thank you all so much. I really appreciate your time.
Thank you so much, Han. We appreciate you joining us today. All right. All right, everybody, moving right along. Kenan, I'll give you a second. Would you mind popping the agenda back up for us, please? Thank you. The next thing on our agenda today is an update from the leadership team. I'll kick it off, and then I see Chris, Elena are on the call, and Kenan as well. From my side of things, we have our in-person meeting. We set a goal to do in-person meetings once a quarter. So far we have achieved 2 of those. Hopefully we'll have a successful third coming up on the 26th. We also set a goal at the beginning of the year for each leadership team member to sponsor an event on behalf of the coalition. And so we'll be checking in on those events and coming out with a few more here at the end of the year. I'll swing it over to Chris in just a few minutes to talk about an exciting event coming up this weekend. But those are our big, objectives. Just making sure as we're heading into Q4 that we're looking good for the end of the year. We're going to get together this Thursday or next Thursday rather, excuse me, and do a bylaws review. Just, per the bylaws, we want to make sure that everything is shored up and relevant and is, consistent with the way that we are currently operating and see ourselves operating in the future as well. So really just want to make sure that we are doing, my goal as chair is to make sure we're doing a lot of end of year planning, that we're supporting Kenan and getting reports in to our funders, that we're also, just doing a general check-in around our goals that we set at our meeting with Paul Short in February, and making sure, just a progress report on where we are and what we need to do to accomplish the last couple of things we haven't quite gotten to yet. So with that, I'll swing it over to Kenan, Chris, or Elena. Y'all want to add anything?
No, I think that pretty much summed it up. I am looking forward to our meeting next week, and I've definitely been reviewing the bylaws, so I hope everyone's coming with notes.
Good.
That sounded really creepy.
Sorry.
I am concerned.
Chris, want to talk about this weekend?
Yep, there we go. I'm sorry, I'm on my phone, so I couldn't find the unmute button. Yes, we are very excited. On Saturday, the Trauma Informed Care Network, TARP, will be a part of the Autumn Jubilee. We have a event within the event. It's called Passport to Wellness. It will be hosted at the First Citizens Bank parking lot in Chase City. And this is an event all about wellness, everything from physical to mental wellness and the different things that
help create our individual wellness and opportunities for us to be the best version of ourselves. So we are very excited about this event, and we hope everyone will come out. We have fun activities for all ages, so we do hope everyone will come out and learn about the many resources that we have here in our community. It's from 9 to 2 on this Saturday, the 21st, in Chase City. And again, that is going to, Passport to Wellness event is part of the Autumn Jubilee. So our event will be hosted at the First Citizens Bank parking lot.
Great. Thank you, Chris.
Thank you.
Yeah. Everybody come out and support us. We're excited. Come get your passport stamped.
Yes. It's going to be fun.
All right. And I distributed the hard copies of those flyers in the room. So if folks want to hang them up, I know we've got it on social media.
I'm being bad. Did you send that to us in an email previously?
Probably.
Okay.
But that's okay. I can send it to you again. Hang on. I can
That'd be
send,
awesome.
I can send it to you
I'll get it
again.
to our Head Start kids, in Mecklenburg County.
Send the flyer to Catherine.
Thank you.
No problem. Anybody else want to get a copy of that? I'll send it to Dennis too. All right.
All right. Any other questions for Chris before she has to hop off?
Kenan, this is Allison, could you send me that flyer too, and I can include it in my email to go out on Friday?
All right, let me do that.
Thank you.
Hey, you having an emergency or something? Okay, I'm in a meeting. I'll call you back. What? Absolutely. Flyer to Allison. All right, anyone else? Awesome. Okay, and Liam, you passed it off. Am I okay to talk about upcoming events, or you may wait until later?
I would say if it's an agenda item, let's wait.
Yes, trainings at the end. Well, yeah, events and
Oh,
trainings.
trainings are okay. I think let's save Sakova and we stand, please.
Okay, all right. So other than Sokoban, we stand. Great. Just want to mention, and I'll pass them out in the room as well. Yeah, a couple of things we still have ongoing, is the harm reduction kits. We still have many of the harm reduction kits. We have press release that's been out since March. We did get another agreement from the North Halifax Volunteer Fire Department. They're now taking harm reduction kits and supplying them when they go on emergency calls. We are still looking for more people to join on that mission with us, getting it in the hands of first responders, emergency services teams. If you know of any connections, please let me know. We're still providing Revive. I think Veronica and I have done like 4 revives this month for private industry. We still have the lunch and learn. Still have requests coming in to do Revive training. And then we have a couple of mental health first aids coming up. We've got one at October the 11th at the Southern Virginia Higher Education, SVHEC in South Boston on October the 11th. That's an adult mental health first aid. And then we have 2 coming up at VCU Hospital. VCU Hospital is honoring us and hosting us to teach the mental health first aid classes in November and December. And I'll share those in just a second on the screen. And we have them posted on our social media as well. And then also, next weekend, we're hosting ACEs at Mount Olive Church in Halifax County. It's open to the community. One of the few times the church has actually encouraged us to share things in the community because they want community members to come as well. So that's coming up next weekend. Those are just trainings that are in the community. Would love you all to come with us. Let's see what I've got here. Let me get those shared. Hang on one second. How am I doing here? Oops, hang on one second. And this is doing to me. Hang on one second. Oops, now my emails come up. That's not good. Oh, there it is. Look at that. Yeah, mental health first aid. Here we go, VCU Hospital, here we go. Yeah. And the ACEs, I know you guys don't see it yet. I know you don't see it yet. There we go. All right, now let's see. Oh, my computer just loves me. There we go. Now where'd they all go? Here they are. All right. So as I just shared, we do continue to provide, oh, there goes the screen. The harm reduction kits, we still have hundreds of them ready to go with syringes, needles, Narcan, fentanyl testing strips. As I said, we have one partnership in Brunswick County and one partnership now in Halifax, emergency services teams who are receiving the no-cost harm reduction kits to give out during emergency calls.
So we have none in Mecklenburg?
We have none in Mecklenburg.
Have you talked to her?
Kenan, I just texted you my sister-in-law's phone number and name, but she's a supervisor at Mecklenburg EMS and she may be willing to help, and I will text her after the meeting as well.
If you would, that'd be great. Let me, okay. I'll write down text message. Okay, I can tell you that we put it in the paper a while back. You can see it's been out since March. So at this point, it's really just word of mouth. I think it's been on our social media a couple of times. I know it goes out in our monthly newsletter. I'll tell you, I think the issue is it's just not getting in front of the right people. So in any way you all can help me with that. And then of course, it usually then requires a sit-down meeting to look at the actual kit, talk about the MOU. I can tell you what the MOU says. It just says that, and there's a couple of bullet points, says that the Southside Behavioral Health and this partner agree to honor the purpose of the program, right? To distribute it when you feel someone's gonna possibly be in need of the kit at a later time. And then also the second bullet statement is that if questioned by local folks about the importance of it, the meaning behind it, that we stand behind the fact that this is part of a harm reduction strategy. And then it's staying in touch with me that once I give you the bags, once you get low and need more bags, to timely reach out to me so we can provide you with more bags so that you're not ever not having the bags accessible. And that really is it.
Pretty simple.
Yeah. Go ahead.
I'd like to tag something on that really quickly. If you do have in the area here, a friend, loved one, anything like that, who is in need of recovery options, there is a new Narcotics Anonymous meet, fairly new, a couple of months old.
Okay.
In Clarksville. That's at 6:30 on Monday nights at the Presbyterian Church right there on Virginia Avenue.
Hold on, Clarksville Presbyterian?
Yes.
Oh, Monday nights,
Monday night, 6:30.
new Narcan.
Whatever needs for
And a
our, that's a Narcotics Anonymous meeting.
Okay,
If anybody needs lists, meeting lists, like I can provide for our district for
Okay.
Alcoholics Anonymous, which stretches from Amelia to South Boston and north of Farmwood.
okay. If you could give me that list and I could put an update out, it'd be great.
Yeah, we're always willing, if you've got doctor's offices, anything like that, or any professional, mental health offices that need meeting lists, if anybody, if I become aware of it, I will ensure that they get it.
Okay,
And I have contacts in Narcotics Anonymous that do the same.
But it's not a list you blanket and you just distribute.
Anybody can have it, it's not a secret.
Oh, okay.
It's anonymous as far as, members, and anonymity has a whole lot more to do with personal humility within people in the program than it does trying to hide from people.
okay. Send it to me, then we can talk about how you want to feature it, how you want to share it. We could do that. Okay. Awesome. Any other questions? Oh, I got some in the chat box. Did we? Liam, I know I'm just helping you. You're leading us.
Oh, you're okay.
So I also, let's see. Oh, I had some other shares. Where'd they go? Where'd they go? Hang on a second. Here they are. There we go. Mental health, mental health first aid, the 2 at the hospital, the screen just shared. The ACEs, that also should be up in front of you now. And then, of course, we continue virtual revive. Again, if you're interested in any of those flyers go on social media. Hang on a second, it's not sharing the way it's supposed to share. There we go. There we go. It's being glitchy with me this morning. There we go. All right, so lots of good trainings happening. Those are the October, November, and moving into December that are already scheduled. All right, that's all I have to report.
All right. Thank you so much, Kenan. For always, for your report and for doing the good work. Next on the agenda, we have Elena with a COC update.
Very little to update on that front. So we are still brainstorming, trying to find an appropriate homeless shelter for the area, which is challenging because we're covering 3 counties. Also, I will say, very busy. We've been very busy. There's still a lot of homelessness in the area. Our emergency shelter funding is seriously depleted, and we've only had the funding for about 2 months. So that's probably going to get worse before it gets better. Our next meeting is October 11th at 10 a.m. and it will be on Zoom. If any of you would like to join, we would very much appreciate it. I will say that our participation has not been amazing. So anybody that would like to join is more than welcome to.
Elena, if you have homeless veterans, please give me a call. We have an issue
Absolutely.
where we can try to get them so it doesn't deplete yours.
Okay.
And I think that's part of our intake process, if you're a veteran or not. So
Yes,
that's
we
great.
definitely ask, are you a veteran? And if they say yes, we always refer them to any veteran resources we're aware of.
Yeah, Elena, if you guys are open to it, I would love to come to the meeting if you have space.
Absolutely. It's on Zoom, so
Okay,
infinite
awesome.
space.
Even better.
Do you want to share that link with us, Elena, and we can get that out? Or how do you want us to connect you to Allison?
I was just going to email her, but I will have
Okay.
Kim send the link out or send it to either me or Kenan so we can also distribute it to everyone else.
Thanks so
Perfect,
much.
thank
And I'll
you.
drop my email in the chat too.
Thank you.
No problem.
You said it's at 10, Elena?
Yes, October 11th at 10.
Okay. 10, 11, and 10. Okay.
Okay, got it. And if you email it to me, I can embed it in the minutes.
Will do.
Okie dokie. Any questions for Elena about the COC? All right, moving right along, passing it over to Allison or Dennis. Not sure, Kenan, update on veteran outreach.
Well, I know that Dennis has something to share, Veronica has something to share, and Allison may also have something to share. So
Okay.
we'll start with Dennis.
Again, just wanted to reiterate, if you've got families with disabilities, October 13th, from 2 o'clock to 4 o'clock at Palmer Point Recreational Area. I will also be, as soon as I get from the people basically running it, I will share those sign-up sheets also. If you have separate families, just give me a call, email me, whatever you want to do, but pass the information to me and we'll make sure there's lots of support for these families. That's it for me. Allison?
Hey, I didn't have a whole lot to highlight. I did want to thank Veronica again for coming to our suicide prevention resource fair. We held it a couple of days ago. So we got pretty good buy-in from some of our community partners, and also VA programs were represented there. It was a pretty cool event, and I think there were about 100 veterans or family members of veterans, military connected people that came through just to get more information about lethal means safety, suicide, all kind of suicide prevention and mental wellness topics. So I feel like it was really well received, and thanks again for making the drive.
No problem. And I'll jump in and just say, I had the opportunity to hang out with both of these individuals, Allison as well as Dennis, and I had an amazing time at both events. Day before yesterday, I went to Richmond, and wow, it was absolutely amazing. When I got there, I was wowed because it was such a huge, such a huge facility, and it just goes to show how many of our veterans are being serviced on multiple levels. The mall was amazing. Allison did a great job with all of the vendors who were there. So I was able to network and not only educate myself, but gather material that I was then able to come and share with our veterans here at the event that I showed up with Dennis, where we had lots of fun, we had lots of food, we had lots of fellowships. So our veterans are being serviced on multiple levels, and it was just amazing to be a part of both events, not only again to educate myself, but to then be able to share the services that we offer here at Southside Behavioral Health. So the networking was amazing, and again, I just gathered so much information. From healthcare for homeless veterans way up in Richmond, where they're able to service our individuals here. But I heard Dennis say that he has connections as well. And then I was excited to make a contact with a young lady by the name of Hope. I believe it was Flumi, who actually did a presentation while I was at the event in Richmond. She offers music therapy for our veterans. So she does virtual, she does face-to-face, she does one-to-one. So, I mean, it was great. Yeah, so I'll be passing this information on also to, not Dennis, but I can't remember his name, our contact that we had in South Boston.
I'm drawing a blank.
We said it at the same time. I know. In my head, but needless to say,
Yeah.
I'll make sure that I get the information passed along.
Yeah, we are gonna, as Veronica's sharing, we are planning out to reach out to some of these partners. Cause some did share with you that they'd be willing to travel to our area,
Yes.
or also provide some virtual services for
Yes.
local vets. So we're gonna work that out with
Yeah.
Dennis and see what's a possibility in the coming months.
There you go.
Yeah.
And that's all I have.
Oh, Darren,
there you
I'm
go,
sorry,
Darren.
Darren, that's the name. I'm sorry, that's the
Darren
name.
Davis, yeah.
We talked about Darren, who's
Yes.
doing veteran outreach and treatment, and yeah,
Yes.
okay. We got it, sorry, my brain's slow this
Okay.
morning. All right, that's a nice veteran update.
All right, thank you all so much. And hey, Veronica, I haven't had the chance to meet you yet, but I hope to meet you very soon.
Yeah.
Welcome.
Thank you.
Okay, next on our agenda is an update from Secova. Stephen, do you have any general updates before we get into the Secova Summit updates?
I do not. I had a doctor's appointment that day. I informed Kenan that I would not be at the meeting this month, but I should be fine for next one.
The only update that I'm aware of is the summit is continuing. They're still opening registrations. We still have those folks who asked to attend were already registered back a few months ago. We're all scheduled as coalition members to meet up either Sunday evening or Monday morning. So we're looking forward to that. And Liam, are you going to talk about our role in the summit? Okay.
So we have officially been asked to speak at the Secova Summit on behalf of the Wellness Coalition and the We Stand Together Summit. The We Stand Together movement at large. So that's a really exciting opportunity. They've given us a really great time slot, I think, and we're in one of the bigger rooms. So it seems like they're really trying to feature this session. So that's a lot of exciting visibility for the coalition and the work we've been doing with the We Stand Together work movement. So excited for that. We've also been between Kenan and myself pretty active in the coordinating and planning, and so we're finalizing the speakers and things like that in the next week or so. Jen sent out the agreements to everyone, the final agreements to everyone last week. So we've sent ours in, it's signed, sealed, delivered. We're there. So we're really excited to be a part of that and get our name out there on a statewide platform.
Yay. Yeah, it'll be the first time our coalition has presented at Secova, so that's exciting. Awesome, awesome.
Hey, are you gonna give us a We Stand Together Summit update? I think you skipped.
Yeah, that's next. Yeah, that's next.
Oh, it was first on my agenda.
Oh, my bad, my bad.
Okay, no.
My bad. I think I'm looking at an old one. But yeah, great. Perfect segue, Catherine. So hopefully I'm gonna screen share real quick too, Kenan. Hopefully you all have heard by now. But if you haven't, we are hosting our We Stand Together Summit in South Boston, Virginia on October 12th. This is a free event for LGBTQIA plus community members and allies. We are going to have tons and tons of educational resources, prevention resources, and lots of vendors there to share their information. Just want to let folks know we are still accepting sponsorship. So if you want to sponsor the event, we can work with you on a sponsorship level that fits your budget. We also still, Catherine, I think have a couple of vendor spaces available.
As of right now, we have up to 4. So I think we have 4 spots if Kenan graciously gives up 1 or 2 of hers.
Oh, yeah, I told you.
Yeah, we have like 9 right now, but Kenan said she really only has to have 1 table, but I reserved 3 for her just because. Cause I like Kenan, no.
Well, that's for
Because it's 3
coalition.
separate organizations.
Right, it's for
So I
Southside
wanted her to
Behavioral
all
Health,
have
the coalition and Trauma Informed Care Network.
Right.
But we can, that's not an
Right.
issue.
So we have at least 3 spots open right now, if not 5.
Okay.
Okay, cool. Thank you. So yeah, if you provide resources to folks in the community or want to just engage with folks in the LGBTQIA plus community and allies, reach out to us. We'd love to have more resources and vendors available for folks. Also really excited to announce that Charlie Burton is going to be our keynote speaker this year. Charlie is the author of The Boy Beneath My Skin, amongst many other things, including being the 2021 recipient of the Outstanding Virginia Award. He's received several equity awards from United Way. He's founded multiple organizations to help LGBTQIA plus folks in recovery find safe and affirming spaces to achieve sobriety if that's their goal. And so really excited to have Charlie. The event is coming together I think really well. You know, we're, like I said, we're gonna have tons of educational events. We're also going to do an after summit mixer at Factory Street Brewing. We'll have some vendors there like crafters and folks, you know, just selling goods, as well as Kaleidoscope VA is sponsoring a DJ, so we will have live music. So I hope you all can come out again, October 12th. It's in downtown South Boston, Virginia. It's at the summit itself is at the Southern Virginia Higher Education Center, which is 820 Bruce Street. And Factory Street Brewing is where the after summit mixer is going to occur. And that is, you walk right across the street from Southern Virginia Higher Education Center. So looking like it's going to be a really good event. A lot of folks here today have put a lot of time and energy into making sure that this resource continues to be available to this community. And so really hope that we see you all there. And again, let us know if you want to be a sponsor or a vendor. So I'll put the registration link in the chat. It is live. I highly encourage that folks sign up. And yeah, let us know if you have any questions. Catherine, Kenan, did I miss anything?
No, can I share screen the poster?
Sure.
Got posters on order, should be here any day now. We ordered 100 posters, 11 by 14, so that we have partnerships. We can go out and ask folks to hang up these posters as well. As soon as they get here, I'll notify the team, see if anyone can come pick up, or Veronica can deliver to you posters. Real quick question, just from my marketing person here. I know that she has access to the folder of materials. The sponsorship ad, is that most recently updated with anything that's supposed to be on it? I didn't know if you were adding sponsors to the sponsorship, like you were adding people that had already sponsored to the sponsorship request, or just take it as it is?
Sorry, I don't think I understand your question, Kenan.
Asking me if the sponsorship sheet is updated, the most recent copy of it.
Oh, that's not my task item. Hold on one second. Let me check. I can find out by the end of the meeting and let you know, Kenan.
And then also, is there a file for are you promoting the Factory Brewery after party, or is that something that's gonna go out at the day of the event?
Yes, we're promoting it. Right now, we've promoted it softly on Instagram, but we've mostly been promoting it by way of seeking vendors.
Okay. So when I talk to her, we want the sponsorship form on our coalition social media. We want the event page I'm sharing now. And then do you want the Factory Street flyer on there as well?
Yes, please.
Okay. All right.
And we have a flyer on that, Liam?
That's what do we have?
We do have a flyer. I'll make sure it's in the folder, and Catherine, I'll email it out to you as well.
All right, email that to me too. That'll just step away from keeping Sarah from having to dig, if you don't mind. Add me that
Okay.
email. Just so I
He's in
can.
a pod.
Okay, pardon me?
He's in a pod.
And also, I did want to mention that we received a small mini grant from the Behavioral Health Equity Grant from DBHDS back last month, to have a budget to create a commercial on the summit that should launch Monday. That's going to run from all of our zip codes all the way up to Blacksburg, because it's going to cover the regional partners. Our suicide prevention regional partners all agreed to be a part of that. And so that's going to launch out. So that should increase registration as well.
Good. Yeah.
Did I say that right, Liam? To make sure.
Mm-hmm. Yeah.
Commercial will run through, it's running through MPI, which is a major media partner based out of Raleigh, but they control markets in Richmond. It'll run from this Monday all the way through the day of the summit.
Cool.
So we'll run on both North Carolina and.
No, they're just based in Raleigh.
No, well, the problem comes in is for a lot of Mecklenburg County, if you have.
North Carolina.
Oh, you mean like well, will be interesting. You guys let us know where you see it. They're supposed to be putting it through. That's not a bad idea, Liam. Should I contact MPI about putting it in some Granville County, or I hadn't thought about that.
I mean, last year we had folks come from Greensboro, so. I can't hear you again, Kenan.
Sorry, they're saying Granville County.
Maybe Mecklenburg, and that's Greensboro, I think, is Mecklenburg.
Oh, you mean Mecklenburg County in North Carolina?
Yeah.
Okay.
Because those border, those two border us pretty.
Okay, I'll mention that to MPI.
Yeah.
If that increases our invoice, we'll just cover that. I'm not gonna worry about that. Okay, all right, so that'll be exciting. I'll mention that. That's not a bad idea, actually. That's a great idea. Glad you all thought of it.
All right, and then Liam, what you drop in the chat box?
The registration link. Okay, any other, oh, sorry, sorry if you're talking, Kenan, I can't hear, I don't want to cut you off.
It's about something in the room that wasn't on the screen, my apologies.
Okay,
Could you hear me, Liam, or you couldn't hear me?
I could hear you talking about North Carolina outreach.
Okay, no, what I was saying is we're asking everybody to sign up as a participant, regardless of why you're there. If you're speaking, if you're vending, whatever, we need to know. And we want to know because of security and for capacity issues. So we're asking everybody who's gonna be there to use this.
Yeah, and for food too, right, Liam, for
Well,
food
yeah,
as well.
and food too.
Right.
Right.
Yeah, okay.
Thank you, I forgot about food, wow.
Okay, all right, and I'll put the link in the minutes as well, but it's also on the screen. All right.
All right. Well, thank you all so much. At this point of the meeting, I'm going to turn it over to our members at large for any general member updates.
Floor is open.
All right, well, hearing no membership updates. Just a reminder, we have the TARP Passport to Wellness event this Saturday, the 21st in Chase City. I hope you all can come out to that. Also, just a reminder, we have several trainings coming up, including an assist on September 25th and 6th. And a revive each month until December. Make sure you check our notes and Kenan's emails to stay up to date on all of our training dates. And again, please join us for the We Stand Together Summit coming to you in October on October 12th in South Boston, Virginia. As Catherine said, please register no matter your role. And we hope to see you there. But otherwise, thank you all so much. It's always a pleasure to be virtually in the space with you. Hope to be in person in this space with you all very soon. And I hope y'all have a great rest of your Thursday and Friday. Y'all take care.